Unless you work in a busy Clozapine clinic, you won't ever prescribe Clozapine 450 times. And even if you do work in such a clinic, you might want to compare your observations with those from Western Australia. They asked, what percentage of patients stop Clozapine and what percentage later resume after waiting how long? Hi, Jim Phelps here for the Psychopharmacology Institute. In this quick take, we'll look at a self-report, if you will, psychiatrists looking at their own patients' records for insights into the experience of Clozapine treatment. It's a great idea, especially when your sample size can be as large as 450 regarding a rather specialized treatment like Clozapine. As you know, this medication can be challenging to prescribe and to initiate and stick with. There's the blood testing every week to start and the logistics of getting those results to the right place at the right time. But once underway, patients have to contend with problems like constipation, sialorrhea, and most concerning, weight gain. In their introduction, the authors of this retrospective chart review remind us that Clozapine is associated with multiple benefits in schizophrenia: reduced mortality, hospitalization, suicide, aggression, and psychosocial decline. But lots of patients stop it. Are there ways to predict, to anticipate that discontinuation, the authors asked? And to answer it, they used their termination report, a checklist that clinicians in these clinics had to complete if Clozapine was discontinued for any reason. These data were entered directly into patients' electronic medical records. So reasons for therapy interruption could be grouped into three main categories: non-adherence, meaning some form of patient's personal choice; adverse effects; and inadequate efficacy. Excluding 2 patients who never actually started Clozapine and 8 who died, the authors examined records for 448 patients. And here's what they found. 30% of their patients never stopped Clozapine in an average of 8 years of follow-up. Among the 70% who did stop, which of the author's 3 reasons do you think was the most common? Non-adherence, meaning some form of personal choice; adverse effects; or inadequate efficacy? Well, it depends, as you might have been tempted to answer. It depends on whether the patient later chose to resume treatment or not. Of the 70% who did stop Clozapine, about half never restarted. In that group, the never returners, for 2/3 of them, discontinuation was due to non-adherence. But among the resumers, the initial discontinuation was due to non-adherence in only about half, so 2/3 versus half. By contrast, side effects accounted for 1/3 of the discontinuations among those who resumed versus 20% of the never returned group. So overall, this makes sense. The restarters group basically recognized the need for treatment either initially or eventually. 80% of them resumed within the first year after stopping. They were somewhat more likely to have stopped due to a side effect, not just non-adherence. So this suggests that aggressively managing side effects could reduce discontinuation rates somewhat. One more interesting finding: discontinuation due to inadequate efficacy was only 6%, and that was among the restarters. In the never returned group, only 1 of 140 patients stopped because of inadequate efficacy. In other words, discontinuing Clozapine because it didn't work well enough was remarkably rare. In summary, Clozapine is hard to start and it's also hard to keep going. In this study, 70% of patients stopped. Half of those later resumed. So it's tricky, isn't it? Efficacy is not the problem. Insight and side effects are. For more on this, there's a literature on Clozapine in diagnoses other than schizophrenia, which was not examined here.